dependence is when a person's body is sort of used to any kind of a substance. So they may need more and more of a certain dose to get the same response that they had in the past, or they'll have a withdrawal symptoms when they stop taking a medication. This can happen whether they're misusing the medication, whether they're addicted to the medication, or whether they're taking it exactly as prescribed. It's just something that happens to the body by taking a medication. Addiction is something different. Addiction is a chronic brain disease that really impacts the person's ability to make decisions, control their impulses, understand ramifications. And we can't see the brain from the outside, but it sort of looks like a person's lost control of their drug use and then lost control of their lives because of that. Addiction as a chronic brain disease means, well, a disease. There's a medical approach to this. This isn't a moral failing or a failing of will. These are changes that occur in the brain. This is a brain disease. And we know how to deal with diseases as doctors. We do evaluations, we come up with treatment plans, we use medications and counseling and bringing in people's families and helping people to really engage themselves actively in managing that. A chronic disease means it doesn't just go away. You don't get fixed. It's something that we call it relapsing and remitting. So it flares up and then it can be quiet, or flares up and can be quiet. And so there are times where people might need active treatment, and sometimes they don't. And sometimes people need to be on maintenance treatments. And so that chronic nature, where we don't expect a person to be sort of fixed the same way they would be fixed if they had an infection that we were able to treat that went away. And really anything involving the brain involves stigma. So we've had stigma around every brain disease, from epilepsy, where people were said to be possessed, to people who were said to be cursed when they had tremors. We haven't come as far with addiction as we have with other brain diseases. You treat chronic diseases of any kind by engaging the patient themselves, engaging their support system, seeing what it is that they're going to be needing to best manage that condition. What you're trying to do is decrease the risk that they're going to die prematurely, or that they're going to have medical complications from their disease that lead to really bad health outcomes for them, or that they're spending all of their time in the hospital and emergency rooms instead of functioning, working, taking care of their kids. That's what we're aiming for in the treatment of any chronic disease. Tip 63 just came out from SAMHSA, which is the United States Substance Abuse and Mental Health Services Administration, and it's around the use of medications to treat opioid use disorder. It's really significant because the federal government has come forward and taken the evidence that's out there and become quite clear that really the standard of care that's expected of clinicians is to talk to people with opioid use disorder about using medications in an ongoing way to manage their disorder. That just not talking about medications is considered not to be appropriate care, according to the federal government. That medications don't assist treatment. Medications are treatment, they're part of treatment, but medications don't take themselves. And patients and their physicians and their entire clinical team need to work together to help those patients do as well as possible.